Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi. Hey guys, how are you doing?
Good, how are you?
Good. So I had the concussion in 2016. One of the biggest hurdles to my recovery is very extreme childhood trauma that I had no recollection of. And it started popping up and coming up in kind of fragments. And I've worked with EMDR, somatic experiencing, so like very severe therapies, very kind of serious therapies, but the limiting factor is that the trauma doesn't come up on a schedule. It comes up when it comes up. And when it comes up, my nervous system just completely, it comes up with very extreme pain and my nervous system just gives in, where the first thing that happens is my digestion shuts down. So I'm not able to eat. I'm following a plan. I have a functional nutritionist. So he gives me following a plan. I'm taking betaine with it, but it just like my body will not accept anything. I worked through the exercises medicine module. And in the beginning, I was having symptoms at even 120 beats per minute. So I've gone up to my maximum heart rate and and I've cleared that. But I still feel that my nervous system is very, very weak in the sense that whenever those stressors come up, my digestion is the first thing that shuts down. And I've realized that my sympathetic nerves are just very strong because of the repeated and chronic trauma from childhood. Mm-hmm. So I have two questions. What can I do? I also recently started doing parts work, Melinda, to try to get myself in a good space when that trauma is coming up. But so what can I do in the short term and what can I do in the long term so that my digestion, my nervous system just gets stronger and I'm able to cope with the stress without the physical repercussions of it?
Mm-hmm. Great question. Thanks for asking and opening up to us about this. Well, first of all, just normalizing that digestion does shut down when we go into a sympathetic state. I think that's probably where Dr. Paul was going to go with that, because in a fight or flight response, we shut down certain functions in order to activate ourselves, to run, to flee, in order to get to safety. Of course, in modern day society, those are usually that evolutionary response is not necessary, but it's still what happens in the body. So normalize that for yourself. It makes sense that digestion shuts down when you have a sympathetic response. But of course, wanting to work towards finding balance so that's not happening chronically to you. Now you shared with us that the childhood trauma was long-standing and rather extreme, which just tells me that this will be a bit of a longer journey for you. Yeah. So I'm hearing that you've already done EMDR, you've done some trauma therapy, you're doing parts work, which is really, so parts work, for people who are on the call today that might not be familiar, there's a psychological theory called internal family systems, which looks at the self as a series of different personalities and parts that can sometimes be in conflict with one another. So when our self is trying to initiate a certain path in life, we can have certain parts that can prevent us from moving forward in those ways because they're working really hard to protect us from past traumas or from being hurt or anything else that might have happened to us in our lifetime. So working on the parts theory is a really great, I think, approach for you, given that you've tried some of the other trauma processing. So EMDR is trauma processing or reprocessing. That's supposed to help support and minimize those intrusive memories that can come up. The other piece is sort of working around whether or not you've had a diagnosis of post-traumatic stress disorder. That can help inform the types of trauma therapy that you can seek out.
Can you talk a little bit more about that, like the benefit of getting a diagnosis? Like I know I have complex PTSD because I have very severe trauma from birth to age 8, and this was like life threatening and it was chronic. So I know, like, I didn't know this, and like, so what's the benefit of getting a diagnosis, and like, how would you?
Yeah. Sometimes there's certain things in the assessments that can point you more directly to what types of therapy are going to be most helpful for the type of trauma that you sustained as a child. And
Okay.
it's very individual. So, I'm hearing you're sort of just doing some of the trauma therapy, but it could be helpful to get that assessment done to understand, well, what specifically are the recommendations for the type of trauma therapy I should be seeking
And
out?
who's the best practitioner to get that assessment from?
What
Like,
yeah, where are
is
you
it a?
located?
I'm in Wilmington, Delaware,
Okay.
The state of Delaware. Like,
So do they have there's clinical psychologists there?
yeah, yeah.
Yeah. So I would
Okay.
say clinical psychologist,
Mhm.
um, would be the best person to seek out a psychological assessment for PTSD or complex PTSD.
Okay.
You can just say PTSD because they'll
Yeah.
determine whether or not they need
Okay.
to rule out complex PTSD. That would be my recommendation. If you're not sure where to
Mhm.
look for that, psychologytoday.com is a resource that we share that's really helpful to search for a qualified mental health professional to support you. So you can look up assessment, psychological assessment for
Mhm.
PTSD using that website and filter for your geographical area, and that will come up. Um, so I would focus on that first before
Mhm.
looking at how to slow down the nervous system response. However, in parallel to the work you're doing, it would be great to just include the light grounding and stabilization work that we explore in the program. So things like walking, mindful walking, so feeling your feet against the ground, including the sounds and senses around you. So
Mhm.
naming what you can hear, what you can see, what you can smell, depending on, of course, making sure that those might not be, that they are not triggers for some of your trauma. I'm not sure what those triggers are. Sometimes senses can be triggering for PTSD. So, really just making sure to speak with a health professional around how you can navigate some of the grounding and stabilization techniques that we offer
Mhm.
here so
Mhm.
that they aren't triggering, because that could also be a possibility of what's happening. Maybe you're working on some nervous system regulating techniques that could be activating a trauma response.
I think I've kind of worked past that. I'm pretty good
Okay,
about identifying triggers. Like, there were certain spices that used to really trigger me, so I would
got you.
like really steer away from them. And I've
Yep.
kind of worked through that. Um,
Mhm.
but I think for me, just, realistically speaking, in terms of getting back, having a career, earning money again, the nervous system is the thing that keeps me kind of stuck, because anytime, first of all, I have no control over when the memory is going to come back. So when it comes back, the first thing that happens is I find that I'm very sensitive to light. So I'm turning my
Mhm.
screen brightness all the way down. I'm turning, I'm pulling in blackout curtains. And
Yeah.
that's the first thing, is because, and, I'm sometimes like, I even have one of those flickers now. So I'll turn the Wi Fi off, and that will help me regulate a little bit. But
Mhm.
realistically, that's not something I can do and keep a job, because I can
Mhm.
control the environment in my own home, but I have to be able to reintegrate into society. And it's been a really
Right.
long time. And I think this is, like you said, I think this trauma, it didn't happen overnight. It wasn't just a one and done thing. So it's going to be kind of like a long haul thing. So I would love to kind of know how to be able to manage it and still have a life.
Absolutely, and I think, you've got a really great start with some of the work you're doing. So potentially a psychological assessment to identify, specifically what types of trauma therapy would be helpful, might be a way to go. And the other piece is that you're here, I would imagine, because you had a concussion. So your trauma history is one of your predisposing factors. So I'm not sure if your, onset of flashbacks or images or intrusive thoughts have come back more since your concussion, but that could
Yes,
be quite
yes,
common. Yeah.
yes, yeah. That's
Mhm.
when it started.
Yes, right. So the history of the trauma was a predisposing factor to developing more long-term or long-standing kind of challenges following concussion. So this is something we really understand now, that can make sort of that concussion recovery more difficult. So for you, you've got sort of different layers of the onion to peel, but I think you're well on your way. The way you're communicating it to me sounds like you've got a lot of awareness and a lot of knowledge about how to support that, and I would keep going on that trajectory.
Thank you. Thank you.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.